Okay.
And like, I mean, I've had patients with who had something called breast implant illness, and
Mhm.
they have symptoms of chronic fatigue. And somehow we figure out that it's the implants, and then they have explant surgery and they feel better. So chronic fatigue syndrome, the causes will be multifactorial. It's like I said, it could be digestive, could be, like you said, hormonal,
Mhm.
and it could be something you wouldn't even think about.
Mm.
Could be like there's something, it's not a diagnosis, but something called sick house syndrome,
Hmm.
meaning there's something in the home. Usually it's like a mold that they haven't seen that may be causing chronic fatigue. Or it could be something simple as anemia that hasn't been addressed by their regular doctor.
I
I
heard.
mean, that's the low hanging fruit because when someone has fatigue and they come in, I do my basic lab test and I always test iron. Some doctors, they'll just test a complete blood count and they're just going to look at the hemoglobin. And if the hemoglobin is normal, they're going to say you don't have anemia. But I've had so many patients who have had iron deficiency that hadn't been tested for, but their hemoglobin was okay. So there's that. And then the big one is thyroid. A
Mhm.
lot of people nowadays are suffering with thyroid issues. So we test those low hanging fruit, and if we don't see anything coming up on labs with that, there's some more advanced tests too. Some people are suffering with chronic Epstein-Barr virus.
Mhm. Mm.
You've probably heard about that, the virus that causes mononucleosis. We could
Mhm.
test for that, and some people, that's one of those viruses, it never leaves your body.